Hi, I'm Annette Allman. I'm a clinical psychologist and also a hypnotherapist at VCPS. I made it a real focus of my practice in the past to focus on depression, and I mainly saw people with depression for many years, but then I decided to broaden what I take on. So I do see people with drug and alcohol issues, existential crisis, identity issues, people with childhood sexual abuse or child abuse, or so I kind of started narrow, but I've become broader in over the years. Well, my approach would be very eclectic. I tend to draw on my clinical psychology training and obviously do CBT, etc., and family therapy and couples therapy. But I've also had a strong interest in Jungian psychology, and I did a couple of years analysis myself. A lot of reading in that area. So I use Jungian techniques, and I also have done training in hypnosis. Some of the misconceptions, I think, are that they're going to be judged. I think that's the most common misconception I've come across. And I work very hard to tell a client, I'm not going to judge you. I'm human. Why would I judge another human? What gives me the right to do that? So often what I have to do is dispel that misconception about they feel they're going to be judged, and they've had lots of judgment in their lives, and they fear it in therapy. And I work really hard to dispel that myth. And the other myths sometimes are that the psychologist is not going to solve their problems. And I work very hard to dispel that myth, because it is important that a psychologist is active in the sessions and works with the client, with them, not doing things to them, and comes up with ideas, insights, possible solutions. A lot of people will go to therapy because they've hit a wall, and it might be a wall of depression, or they're so consumed by anxiety, and they will kind of get to the stage where talking to their friends and family is just not enough, or there's a need to get a sense of objectivity about what they're going through. I see therapy is helping people to develop a conscious awareness of themselves, to see themselves from a mountaintop view, to see the bigger picture in their lives, to have a look at the lessons and the teachings and the growth in it, because that's what makes the pearl. It's the grit, it's the difficulties, that's the nature of human existence. They should expect to be heard, and not just heard, but really understood. They should expect their psychologist to move into their inner world and hear it and see it, the world from their point of view. And they should expect their psychologist to join on that. And then their psychologist to come from a position of knowledge and experience to help them out of it if it's depression, to help them escape it if it's anxiety, to help them to reframe it and leave it behind if it's trauma. They should expect their psychologist to work for them. Well, I love it. I have always kind of been in a private practice, mainly on my own, and doing a lot of the background work myself. And I've come to VCPS, and all of that is done for me. And I've got a wonderful team here. The intake team will screen the calls, say to me, hey, I've got this person, could you see them? And we discuss it a little bit. And then, the admin and reception team are wonderful. So I feel really fully supported. And the beauty of that is I go to work and I see my clients, and that's the work I love doing, is being with the clients. I'm not really interested in the paperwork, the background sort of making appointments and billing and things. I want to kind of stay in that zone of being clinically present with people, and VCPS provides all that for me, and I get to work with wonderful people. I should have done this years ago.